Good morning, my name is Doug Eunice and I'm an orthopedic surgeon here at Mount Sinai. I'm over at Mount Sinai West. I specialize in hip and knee replacement. I'm also the founder and chief medical officer of a startup that spun out of Icon last year called Monogram Orthopedics. And today I'm going to talk about developing medical devices in the context of the fourth industrial revolution. And I'll get into a little bit about what defines the fourth industrial revolution and how that is impacting the next generation of medical device and technology. So just a little history. There have been three prior industrial revolutions, starting with the first in the 1800s, where mechanization and water and steam power created more powerful, faster factories. The second revolution was in the early 20th century and involved mechanization and mass production, division of labor, think assembly line, Henry Ford type manufacturing. The third industrial revolution was in the 50s and 60s and surrounded computerization and automation. And there are many economists who are now touting the fourth industrial revolution. The German government is actually calling it Industry 4.0, and they're really pushing this to develop a new economy in Europe. The fourth industrial revolution is different from the other three in that it involves the marriage of the physical and the digital. And there's kind of the center of it is this something called a CyberPhysical System. And I'm going to talk a little bit about that in a second. But essentially, there's been a coalescence of new technologies in the recent 10 years or so that have coalesced to bring about this new wave of industrialization, and it's enabled, among other things, mass customization on a wide-ranging level. Here's what I think is a pretty easy to understand example of a cyber-physical system, and it's the Google self-driving car. It's essentially a car like we've always had, except that instead of just being a car that's made the same for everybody and you just get in and you have to drive it manually, this car interacts with its surroundings. So it's laden with sensors that are constantly feeding information, analyzing information from the physical world. The information becomes digital, goes into the car, where the car then uses that information to translate it into physical action. So I think that, there's a lot to this concept of the fourth industrial revolution, but I think if we imagine it as this interplay between moving from the physical and digital world using new technologies, to me, that's it in a nutshell, and you'll see how that affects medicine and has implications for medicine in a bit. Some of the drivers, technology-wise, of this revolution are additive manufacturing and collaborative robotics, which are part of the physical aspect of the fourth industrial revolution. They allow us to create manifestations of digital information in a way that we really haven't been able to do before. And then on the digital side, artificial intelligence, cloud computing, so-called deep learning, this is more on the digital side. And when we combine these different technologies, what we're seeing is an increase in efficiency, decentralization of manufacturing with smart factories. That can produce things on a smaller, more local, more customized, customer-based scale. We're seeing augmented workplaces where a worker can have super strength, supervision, super dexterity. And these are things that have implications, of course, in surgery for sure. And we're seeing custom tailored products, mass customization, as I touched on earlier. So back to this idea of physical and digital interaction. This slide gives you an idea of what I mean by that. So some technologies that allow us to go from physical to digital are sensors, wearable devices like Fitbit, or augmented reality, goggles, Google Glass, that kind of thing. Technologies that allow us to move from the digital to the physical are things like additive manufacturing. You take a CAD file, a digital CAD file, and that then becomes a physical object. Advanced materials, autonomous robots can take digital instructions and execute something, whether it's milling a piece of metal or doing any number of tasks. So this, I think, gives you an idea of what we're talking about. And these types of cyber-physical systems are going to impact medicine, and I'll give you just a couple of examples. Medical devices that have that are laden with sensors, wearables, things that detect the environment around a person, implantable devices, and the Internet of Things to allow monitoring of things like chronic diseases or blood glucose or the pH of your eye. Any number of these things that can not only monitor and analyze and pull data out of a wearer or someone that has this implanted, but they can then transmit that. This type of technology can be networked so that a physician or a healthcare team can do something with that data. Another example of a CPS, cyber-physical system, would be a robot that is specifically geared towards helping an elderly person with activities of daily living, administering meds, even mobility, carrying a elderly patient from place to place, up and down stairs, etc. And then finally, and this is pretty far outside of my area of expertise, but genomics and being able to take the human genome to using things like CRISPR technology to personalize pharmaceuticals to really match a particular patient's genome. So I wanted to try to illustrate this whole physical to digital thing with a total knee. So this is just a generic picture I pulled off the internet of a total knee, and an industry 3.0 total knee is just basically a stock piece of metal that's not built for any specific person. Comes in different sizes, but it's made with traditional casting and traditional manufacturing techniques, and it works. There's nothing wrong with it. But walk through with me. I'm going to try to imagine a total knee 4.0 and see how many times I can cross between physical and digital with this maybe a new type of device. So first we start with an image of the patient's anatomy, digital. We take that, we manipulate it and turn that into a CAD file of a custom implant that would match only that patient. That CAD file then gets put into a 3D printer, which turns it into a physical product. So there we've crossed from digital to physical once. That physical product is also embedded with various microprocessors and sensors that can do things like monitor wear in the prosthesis. So if the knee prematurely starts to wear out, these sensors would pick it up, it's networked, it would be sent to the surgeon, and we might be able to detect early wear much quicker than we would normally be able to do without x-rays, without bringing the patient back unnecessarily. So that's, again, digital to physical. We're taking a digital information from a microchip, physical information from the local environment of the knee. We're digitally sending it back to the surgeon, and then physical action is taken. The knee could also be embedded with microprocessors that could detect microbial activity and even the genetic makeup of local microbes. So if there was an infection in the knee, it could be detected early, and perhaps even the type of microbe could be identified with an embedded technology. And I think that These are the kinds of things that really redefine medical devices in this new paradigm of Industry 4.0. So that's an example from my world, but whatever area of medicine or science you operate in, I'm sure you can reimagine any number of things along similar lines. My company, without getting into the secret sauce, does a lot of the elements of Industry 4.0. We have robotics and 3D printing, and we are manipulating patients' images and modeling their anatomy to create what we think is a better, more patient-centric, patient-matched type of joint replacement. And I'll leave you with this one thought. This is from the Davos World Economic Forum I think from 2014, and this is from Klaus Schwab, who was the founder of the Davos World Economic Forum. And he said, companies able to combine multiple dimensions, digital, physical, and biological, often succeed in disrupting an entire industry and their related systems of production, distribution, and consumption. So think about that as you go forward and redefine whatever part of medicine you're in. Thank you.